Welcome to CNA TV. I'm Lori Porter. I have the honor of serving as the Chief Executive Officer of the National Association of Healthcare Assistants. And I'm honored to be here today with our Board of Directors. They've been in town for 2 days bossing me around. Man, have I had a workout. I'm telling you, they know how to bring it on. But I am so proud of all that they have accomplished this week. All we have accomplished, and I think they seemed pretty proud of their staff that's here at NAHCA and the work that we're doing. They had a few critiques, so make no mistake, they're on the ball. But anyway, while they were in town, I wanted them to have an opportunity to be on CNA TV and for you all to have an opportunity to meet them and understand who the CNA leaders are of NAHCA. Over the last year, we worked very hard to turn NAHCA into an association in which CNAs will actually run it. I'm not going to live forever, and one day maybe I'll get to retire. And if that's the case, then I will completely turn this over to the Board of Directors. They will hire the next CEO. Hopefully that will be a long time off yet, at least another 10 years.
Yes.
Anyway,
Yes.
But you know, they do now have the power to fire me. I'm just going to work so hard and be so indispensable that they would never think of doing that to the co-founder. Anyways, they probably won't let the next CEO off so easy, though.
No.
So I score a few points for being the co-founder. So anyway, I thought we would. I'm going to ask the board some questions if I can keep a hold of them. Pardon me, I dropped my question card. But I'm going to ask them some questions so you have an opportunity to get to know who they are and understand what their commitment is to you as members of our association and to the association itself, carrying it into the future. Those of you that are on the front lines at 20, 19, 18, Sam, didn't you say 17? In some cases, we have CNA 17 caregivers, so we want to be sure that this association lasts for your lifetime as well. And while you're in the career of CNA or assisted living caregiver, we hope you'll stay in this career. However, we're here to help you if you want to continue your education. NAHCA is all about that.
That's
as
what
well.
we're here for.
So, how many of you, before I let everybody introduce themselves, because everyone that goes to conference knows you guys, right? They get to see you every year, so they know who you are. But our viewers, our members across the land have no idea who our board is unless they go to the website. Which, by the way, if you go to the NAHCA website, you can email any one of these characters at any time. They love to hear from our members and are happy to answer questions and provide you with any level of support you need. So don't hesitate to check them out on our website, NAHCACNA.org. Wendell, introduce yourself a little bit. Tell them who you are.
Well, my name is Wendell Anderson. I am the chairman of the Board of Directors of NAHCA. I've been a CNA for over 30 years. I say 32 years now. And I've been with NAHCA for 10 years.
10 years.
10 years.
Wow.
And have enjoyed every moment of it.
I can say I enjoyed every moment of it until he became the chairman. I'll tell you, there's something about that chairman's gavel where they think that they're in control. He has his work cut out for him with all these women, however. And I think really what we need to do, because we're minus one board member today.
Yes, we are.
Yes.
We are.
Yes. We are.
And that's Sherry Perry.
That's right.
Yeah.
And we have missed her dearly.
Dearly.
Have we
Yes.
not?
Yes, we have.
Sherry I imagine she's pretty depressed that she's not able to be here. However, she had to tend to a sick loved one, and we certainly understand that, and our hearts and prayers and thoughts have been with her this whole last 2 days that we've been together. We've missed her very much. She's the secretary of our board of directors, and she keeps all the minutes and the notes, and so we have truly missed her these last
We've
2
been lost
days.
without her.
Lost.
And I think I did a good job on the notes.
Yeah,
Sherry.
I think you did. Sherry, I'm going to vouch. I think they all took notes, and I remember that you did tell me. Now I'm going to get you in trouble here because you told me the other night they all send me their notes, and I can't make heads or tails of it. You would think we were all at 6 or 7 different meetings when I get these notes. So anyway, it's funny to see. But I told her, I said, well, at least we captured everything.
There you go.
Because everyone has a different perspective on what's going on.
Right.
Anyway, but we do miss you, Sherry. And Gary will put up our director and producer of CNA TV and creative director with NAHCA. He'll put up Sherry's picture so you'll get to see who she is. And she's certainly loved by all of us, and I think most of you that have gotten a chance to know her. I'm going to take a minute and ask a few questions of our board of directors. I let Wendell introduce himself, so I want to get back to that and start with Tina again. And Tina, tell our members who you are.
I'm Tina. I've been CNA for 42 years.
42 years.
42.
Wow.
Been a
I
member.
think we all need
Yeah, we have to give you a hand for that one, Tina.
We knew that she'd been a CNA a long time. Tina, how'd you have the strength to get here after 42
Hey, I
years?
keep going no matter
And
what.
Like nearly a heart attack last week or something, right?
The Energizer Bunny.
There you
I
go.
keep it going.
All right. Tina, tell them all about yourself.
I've been a CNA for 16 years, been part of NAHCA for about 8 or 9.
Awesome. And 16 years at the same place?
Yes, I've been at Wilkins Health and Rehab for all 16 years.
Awesome. Good job. Corinne, how about you? Tell us what you're all about.
Well, I'm from the state of Missouri. I'm also the in-house coach for Missouri Veterans Home.
Awesome.
Been in the association for 11 years and been a CNA since 1985.
Awesome.
All right.
Excellent.
I'm Samantha Maddox, and I'm from Oklahoma. I've been a CNA for going on 8 years, and I've been a member of NAHCA for 7. I've been on this board, this crazy board, for 4 years. For about
Thanks,
4
Sam.
years.
4 years. Outstanding. We haven't figured her out yet. She will probably be the chairman in about 6 years or less that she'll be leading our board of directors. Our board ascends from one office to another, and then they term limit out eventually off the board, and we'll be searching and looking for those members who are eager to serve the association. And we were talking all this week about how we need to ask not what the association can do for us, but what we can do for the association. And that's how these ladies and one gentleman serve.
That one man.
And that kind of brings me to, Wendell has been in service to NAHCA for many years now. He served on our steering commission. He was a member for several years before that appointment. And I need to tell you that Wendell works in a very challenging facility. I will be the first to say, when I was a CNA, those 7 years, I could not live up to what he and his fellow CNAs and caregivers live up to.
Thank you, Lori.
And
Thank you.
they take care of, their whole facility is behavioral care. And those of you that are out there that have asked us and you've had concerns, you've said, now we have a mixed population. We have grandmas and grandpas, and now we have behavioral patients. And it's difficult to mix the two. But I will tell you this, when I go to Wendell's facility, Maravilla Care Center down in Phoenix, Arizona, I am reminded of the true grit many CNAs in this country are made of. And so not only have I been honored to know Wendell and have him as a member, I've been honored to have him on the board. And you've served as the board chair now for almost a year.
Yes. Yes.
or it has been a year.
It has been a year. Yeah.
And you've got another 3 years of service at a minimum as our board chair. What is it you want to accomplish? Where do you want to take this association?
That's a good question, Lori. My intent is to continue to elevate the CNAs, train them to one day be part of the board, and take over the noble association that we are part of.
Outstanding. That Wendell made it sound really simple, by the way. But this is a heavy lift. So many of you out there feel like your voice doesn't matter, you don't count. But I want to tell you, at NAHCA, you have people that care about you. And you have this group of individuals plus Sherry Perry to fight for you, to advocate for you, and to put together the best association possible for CNAs. I don't
That's right.
suppose we
That's
have
right.
all the answers.
We don't.
Gosh, no.
But we do know that CNAs matter.
matter.
We do. Wendell, don't be touching.
Keep your hands to yourself, big boy.
Please. They just can't help themselves. That's all there is to
Charlie
it.
and all.
We got this done
And
with
you know,
Wendell.
it's not like Tina's the most well endowed of all the women in the room, but we won't ask him
Size
to.
don't count.
Size doesn't matter, Tina says. Well,
All the way around.
that kind of brings me to Tina's question. Tina, we go way back. I don't even know how dang far back. I know I've been to
2000.
Golden Girls a long time ago when I visited your center. It's the best damn restaurant in the United States of America.
Tennessee.
Golden Girls. If you're ever going through Tennessee, it's just a 20-mile shot north of Knoxville. On what's that interstate?
Clinton Highway.
Clinton Highway. So take Clinton Highway and the Golden Girls send me a check for this plug. But it's the best Southern food you're ever going to have, and it's fabulous. I kind of understand that you've been in this industry, this profession, since you were, in the womb?
Yes.
Pretty much.
You might want to explain that.
Please.
You're a little too young to be certified when you're in the womb.
My
so-
mother was a nurse. So when I was born,
Did she work in a nursing home?
yes. Yes.
Wow.
And my sister was in nursing school when I was born. She's 18
So
years
your
old now.
nurses, your sister's in the business as well?
She's an RN and an administrator.
A nursing
wow.
home administrator? Wow.
For 30 years.
Outstanding. And 42 years you've been in it. What is it that you bring to this group of yahoos?
Well, I'm the fun one.
Yes, she is. She is.
We'll say,
I keep these guys, everybody else keeps them in line, I keep them laughing.
I'll tell you what, Tina's one of the most generous people you'll ever find on the
Yes.
planet. She brought me a token gift that was her mother's that's very meaningful this trip, and I will cherish it forever. And I will pass it down to a CNA who deserves it. So thank you very much, Tina, for your
welcome.
service and all that you do for the board of directors. Sheena,
Yes, ma'am.
I'm right here on top of you.
Don't be touching.
Let me do a Wendell. Okay? No CNA's matter. No. I didn't come in quite as close.
It's okay, Wendell.
Anyway, Gary's red behind the camera. A couple weeks ago, Sheena called me, and she'd gone through a challenging time at work, and I was real proud of the way you handled it and all of that. But and it all turned out in your favor
It did.
and such. But I know you were like a punch in the gut there for a day
It
or
was.
two. How did you pull yourself out of that to still be motivated enough to be on this board and continue to lead?
I think it's kind of like any, I don't know, I'll call it a life lesson, I guess. It's kind of like any life lesson when you get knocked down. You have to kind of reevaluate everything that's going on. And I sat back and realized that I had a good support system here with my NAHCA family, and I had a good support system at my work. And that, you know, I'm blessed to get to wake up every morning and go do what I love and get to take care of people, and that I wasn't going to let anything stop me. So I
Hey.
continue to do it.
Well, I know that her fellow board members are proud of her for the way she handled that issue, and certainly we had her back, and that's what we want to do. NAHCA really stands for the best CNAs in the business, wouldn't you say?
Exceptional.
Exceptional. We had a discussion today about what makes NAHCA so fabulous, and it's we turn good caregivers into exceptional caregivers.
Definitely.
Once they've drinking what we often refer to
Kool-Aid.
funnily is they have drank the NAHCA Kool-Aid. So I drank the NAHCA Kool-Aid the night I dreamt of it, and I've been drinking it ever since. And many of us are drunk on NAHCA punch. Not today, by the way. But after all, after CNA Fest this year, would you say? I mean, it was the least fancy
It was the most
that
fun.
we've
was the
ever
most fun.
had. But wasn't it the most fun?
Yes.
We really got to communicate with
Yeah.
our members and just get to
No
know each other outside and
distractions.
just relax.
Yeah.
And
More
you know,
personal
awesome.
for us.
Now, didn't
Right,
you guys
yes.
review the evaluations from
Yes,
CNA Fest?
they were awesome.
Most of them were awesome, right?
yeah.
But there were a
Some
couple
we had
of
some that-
people that weren't quite all about it. Now we
is
have to
fine.
say that some of the drawbacks of being there are the accommodations, the housing accommodations.
You're not at a 5-star hotel.
It's pretty primitive. I mean, it's like dorm room or church
Right.
camp. So people have to share rooms, and not everybody's cool with that. But it's amazing how once they get there, as afraid as they are, that they normally.
It's a good bonding.
Who cares about the accommodations? We're there to learn and network and have a good
Right.
time and
Right.
celebrate who we are. So,
Right.
but overall, it was a fabulous experience.
Amazing.
Wasn't
Wow.
it?
And if
Yeah.
you're
Yeah.
Wendell, you don't sleep at conference.
He just went all night long, all
You'd
night.
be out there with
I don't
like
think
4
many
in
of
the
us got
morning.
very much sleep.
I don't think any of us slept a lot
No.
during
We
that
worked
We
time.
never
There's
do.
a lot of work
We don't
behind
eat
the
much
scenes.
either.
So many CNAs to meet and greet to. I mean,
Exactly.
I was just indulged in that.
And you
Right.
guys really got to find out what it's like meeting people at the airport and picking
Right.
them up and transporting and making sure we had no idea Sheena had a horrific fear of airports, and so we sent her out there for a 3-hour stint. And Jeff Wellman made these little jackets so we'd be recognizable, and were we? We were very recognizable. They were getting all kinds of requests from travelers. Where do I go for gate so and so? Where's the bar? How do I get to the terminal C? So anyway, we did a good service not only at CNA Fest but for Little
I said,
Rock.
me and Sherry Perry said that we should be able to put that on our resume now that we worked at Little Rock.
Yeah, probably so. But anyway, we thank you for making it through that challenge. And moving along a little bit, let's go back to Lisa. We didn't get you introduced yet, did we? Or did we
No.
skip Sam? No, we got Sam.
We this way.
That Lisa.
I'm Lisa Shepard. I am from Dubuque, East Dubuque, Illinois. Work in Iowa. I have been with NAHCA since January of 2010. I have been on the board. Oh my gosh, I don't know, 6 or 7 years. I was a treasurer for most of that from the beginning until this last year, and now I am the vice chair.
That means
Yay.
she'll succeed Wendell unless for some reason the members don't want
They
her.
probably,
so-
or Lori tells me I'm too bossy. I have been a CNA since 1986.
Awesome.
So
That's a
Yeah.
while.
yeah, so
I
I've worked
guess
in nursing
I've
homes
been
and I've
a
worked
We
in
in our
hospitals.
30s.
I was a
We're
CNA
old
in 1980, but I must be older than you by about 6 years, I think.
Oh,
We won't discuss age, but
No,
are you 5'0"?
I'm over 5'0".
Oh, well, I'm over 5'0" too.
I'm,
5'0".
give me another
Wendell's
year.
5'0".
I'm 5'0".
I'm the 5'1".
I'm up that.
Wendell's expecting, by the way, so we'll have a little Senator Anderson come next conference.
Future
Yes, we
male
will.
CNA.
That's right.
Future male
That's right.
CNA.
That's
Awesome.
right.
Well, Wendell, speaking of which, would you encourage that?
Yes, I definitely. I would.
And your children and your
I
son?
would. I would. I was encouraged myself, you know. So yes,
Awesome.
I would definitely.
You wouldn't say,
encourage
son,
that.
do anything else, but God forsake, don't be a CNA. That's
I
not
would not
your
say
advice.
that. No, not at all.
Awesome.
This is a great profession.
It is.
It is a great profession. It's hard as heck.
I mean, I've
But
left
it's
it,
very
came back
rewarding.
many
Yeah,
a time
right.
because it's just what is in our hearts.
Lisa's been giving me trouble all day, so
Oh, come on.
I'm gonna throw this question on her. What's
Uh-oh.
one of the biggest challenges
Uh-oh.
we face as a board? You face as a board of directors.
Oh, watch out now.
Keeping you all in line. Yes. Let's get to it. We have a lot to
I knew
accomplish
it.
in
I
2
knew
days.
it. I knew that's what she would say.
You know, I've learned from So
Yeah.
we just need to keep in line.
We
and
discuss things sometimes till it's,
Lori doesn't shut up.
but they won't fire me. Just
No, but sometimes we have to have him hit the gavel so that we can get back on
yes.
task.
Wendell lines me out when I jump on one of their board calls. That
5 minutes,
that's
Lori.
my instructions. 5 minutes, Lori. You
5
better make it
minutes.
count. I am really enjoying having this active board of CNAs, and there's nothing that's ever going to make me happier than seeing them able to run this organization into the future beyond me and Lisa. And it's special for us to be with you guys here at the office and having you in town. I want to take just a second in case some of your employers are watching, or that you share it with them and they get to see this opportunity. It's my job now to thank you all for supporting Wendell and Tina and Sheena and Corinne, Sam, Lisa and Sherry. They couldn't serve this board if it weren't for the fact that they could get off work. Some of them get paid. Some of them don't get paid, and they still serve anyway. That's the level of importance this organization has to you all, and that's what means the most to me. Don't think they're in 5-star hotels. There's no way. They like to save the organization money any way they can. They don't travel large. It takes a whole lot to get them all here. A lot of employer support, a lot of NAHCA support, and we don't waste our time. Even though Lisa says we talk things to death, I'm a believer that if the plan isn't working, you have to change the plan. So we discuss the different changes of the plan. But anyway, we always get to the best place, I think, don't we?
We do.
No
We
matter,
work hours.
we don't always agree, they don't always agree.
No.
But I certainly have been very proud of how the fact you've come to consensus, and some of you are willing to bend. But you're always, I think, now you correct me if I'm wrong, do you always feel like each other is listened to?
Yeah.
Oh,
think
God, yeah.
so.
We're all so different, but we all listen to each other's ideas and we come up with the best outcome.
Yes.
A lot of there's 7 different personalities
Oh, gosh,
among
yeah.
all of you guys. And
Sometimes they show.
sometimes, but you
always
know,
come
it
to the
isn't.
best.
I mean, I think we've all kind of evolved into friends of
Okay.
whether it's professional friends or
Or family.
personal friends or family. We kind of call it the firm sometimes. If any of you are old enough to remember the Tom Cruise movie, The Firm. Yeah, we don't like it when people get out. We love to have a brotherhood and sisterhood in
That's true.
NAHCA.
Right.
And the one thing we know is many of our members are struggling. The industry is short 200,000 CNAs and caregivers across the senior care and hospice, home health, and throughout the nation. So unemployment's the lowest it's ever been.
Right.
Where are we going to find the folks to take care of our residents? We see on Facebook every day our members are posting, I took care of 17 today. I had 28.
Yeah.
There were call-ins. I had 36.
Yeah.
The shortage is real. You're paying a price. The residents are paying a price. The facilities are paying a price. And I don't think you all have do you think you've been a CNA all these years because you couldn't do anything else?
No.
Gosh, no.
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 We choose to do what we do.
No.
It's it's like a calling.
Calling?
It's just something
It's
that
in here.
Yeah, it's just something that I love to do, and it's what I don't even like think about anything else. It's
Yeah,
like
you have to have the heart,
Yep.
the passion to.
Well,
to do it.
Samantha is our youngest of our group,
Our
and
millennial.
she
Our baby.
often gets referred to as our millennial, which probably she doesn't care for because I know my son doesn't necessarily like being referred to as a millennial. And people have thought millennials don't care.
oh,
I'm here to tell you, and Sam can probably tell you better than I can, that millennials do care. They may care the most that we've ever seen. Now they will unplug Grandpa's oxygen tank to charge their cell phone.
No, I'm good.
But they do want to make a difference in this world. I always say that the millennials are smarter than we are, and that's why we're so mad at them, is because they were, you know, we were duped into working 60, 70 hours a week our whole life, and they're like, we're not going to do it. There's more to life than work. We didn't learn that lesson, so now we're just pissed and talk about them all the time because we weren't smart enough to pull that off like they are. But anyway, Sam, what do we have as an association? 2 Broad started 25 years ago. As a matter of fact, next year's our 25th anniversary.
Yeah.
Silver anniversary of NAHCA. So, why do you and folks your age join NAHCA and want to be a part of it?
I can't speak for everyone, but for myself, I like being a part of NAHCA because it makes it's proving that the profession's not ever going to die, and that we need kids my age to keep it going.
I think that's
That's
right.
good. I
That
like that,
is
Sam.
And
like
I'm
that.
not just a millennial; I'm the hairdresser too.
Not very good. She's the hairdresser. Yeah, before we all came on, you know, you can tell I don't do a whole lot to this layout here, but they're all in the bathroom, and Sam's girl, she's the hairdresser.
Not me though.
Not me.
All natural
She
too.
got Wendell's real tight.
I'm gonna get Lori's next.
Yeah, I probably won't have any hair left after that. Oh, I'm sorry. The curling iron temperature was at 3,000. I burned all your hair off. Well, Corinne, I don't know if have we let you introduce yourself or
Yeah,
anything?
you
You
did.
did get to introduce yourself, but I'll tell you, I'll never forget when we first met. And Corinne's name is spelled Karren. It's not that difficult. But for some reason, I could Karen, maybe it's Curran. Her damn name's Corinne. And I Ganchinitz.
The last one, right?
Oh, I got that last one down. Y'all have spelled her name so many times I have it. I can take you upstairs and show you my office. On the side of my wall next to my computer monitor, I has important things to remember. Ganchinitz, how to spell it. Because I've misspelled it so much. But Corinne, when we first met, it was through your staff development coordinator there at the Veterans Home. Her name is Nancy Maddox.
Nancy
She's
Maddox.
retired now.
Yes.
But she was for probably at least 10, if not 15 years of NAHCA's lifetime out of the 25. I had to put up with this lady named Nancy Maddox. She was an RN SDC and the toughest old broad I ever knew. But anyway, I loved her even though she was sometimes a pain in my rear end. But she was a stickler for detail and development and education, and she didn't allow NAHCA to get anything wrong. So I always kind of thought, boy, what would it be like to work with her every day? Corinne, tell me about Nancy Maddox.
You're putting me on the spot, but she was awesome. She was never a negative Nancy. She was always positive. Sometimes when she would come down the hall, we would kind of go, and hide a little bit, but she always seemed to find us one way.
Yeah, I have no doubt. She'd always seem to find me. I could be out in the middle of New Mexico somewhere and the cell phone would ring up. Lori, there's a misspelling in the newsletter. But that's Nancy, right?
She loved NAHCA. She always supported it. She wanted the CNAs to be the best that we could be. I remember her telling us one time, you pick a mentor. You don't become that mentor, but you rise above that mentor. And that was
Wow.
one thing that she taught us.
That's great advice. I
It is.
wish I'd have thought of that. Dang, Nancy. But I want to give a shout out to Nancy. I asked that question specifically because I was always honored to work with Nancy, and she's what led Corinne to NAHCA. So
Yeah.
I'll forever be grateful that
Yeah.
that was your entry into our association. We've got our 2019. It's not 2019 yet, but we certainly want to go ahead and start talking about it. What? Did I do something
No,
wrong?
that light. It's right there.
Oh, well.
I'm not crying. It's
Bright
that
lights,
light.
big
She's
city.
crying. She's always crying.
Corinne's
Big
always
time,
crying.
baby.
Or yeah, well, we'll leave that where it is. But anyway, we have been talking and planning CNA Fest 2019. I believe our theme is going to be one voice.
One voice, one
One
sound,
sound,
one
one
connection.
connection.
We are all 2019 is going to be about connections, connecting to one another, connecting through NAHCA, growing our association, strengthening our leadership, strengthening our professional service that we provide, standing above those who may be in our profession for the wrong reason. I think we've all witnessed that or had to work with someone who we felt may not be the best person, the best choice to become a CNA.
Right, right.
But CNA Fest 2019, the dates are, I hope one of you guys know it.
28th and the 29th.
28th
Wednesday,
and 29th
Thursday.
of August 2019. We'll be back in Little Rock, Arkansas at our members' request, even though back to the avowals, a few people had some issues with the rooming stuff, but we're not going to let that slow us down. We appreciate your comments, and if there's anything that we can do to make improvements there, we certainly will take all those comments seriously. And so we appreciate all of the folks who attended 2018 and filled out those evaluations.
Thank you.
Yeah.
Yes.
So the conference has been planned, the agenda has been set. We have a few more speakers we have to consider before the agenda is finalized, correct?
Correct.
And we believe those materials will be up and ready and out starting January 2019. We'll be
Exciting.
And we picked some good food for next year.
They picked the menu.
Yeah.
Different selection of food this
More
year.
mix up.
Gonna have a cookout.
Yep.
Cookout social, and everybody
Yoga.
get to know each other. and
More
what-
people can
Yoga.
zip line.
Oh, and the zip line.
the
I
zip
want to
line.
talk about that a little bit for those of you who may be watching who attended this past year and didn't get a chance to zip line. That will be moved now to Wednesday evening, August 28th.
Eighth.
And that will be in the afternoon. We generally try now at the in Little Rock at the 4-H Center, Vine Center. We try to quit at 3 o'clock every day for our sessions so that we can do outdoor activities. So the zip line will run that afternoon on Wednesday, so everybody will get a chance. Some of you missed that opportunity because you didn't get in till late. Lisa is one that Tina didn't get the chance. So we'll have the they're gonna do the zip line on Wednesday, the first day, evening after conference. So I think that'll be great. Anything else about conference that we need to report this early, or just
Well, registration should be a lot smoother next year.
okay, super.
I think we've learned a lot because that was really different this year because we were handing out room keys and trying to do everything at once. So this year, next year, yeah.
The
We're
Yeah.
club
used to
account
that.
is up and running.
The what?
The club account.
Oh
is up
yes,
and
the
running.
club account is up and going for 2019. I think there's already been a few people
Yep.
open their
That's what
accounts,
Dane was
if I'm
saying.
correct.
Yeah,
and,
that's what Dane reported off.
so we want to get as many as possible, or have as many as possible have the opportunity to come through that savings
It's a
program.
very good program.
Too early to announce much else, but you are working on a number of things to bring value to the association.
Yep.
We may be introducing a new membership level soon, and we're anxious and
Exciting.
excited about that. And we hope that 2019 is a big year, as Wendell said, to grow the association and to strengthen it and to develop leaders for the future.
Yes.
Unless you all think of anything else that I need to quiz you about here, I think each of you want to give just a little closing of what NAHCA means to you, or how about this? What's this board? Why did you want to serve on this board?
Oh wow! You know, for me, I just wanted to be able to be part of the change that NAHCA's NAHCA experiencing right now. I wanted to be able to be there as we set forth on a new path to better the association.
Excellent.
Share,
Tina?
yeah.
Or Lisa, go
Share
ahead.
share ideas and try to make it even better than what it already is, and make great CNAs exceptional.
Yeah.
That's yeah.
Anybody else?
To preserve our profession, to keep it going.
Yeah.
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 It's taken a few hits and things have gotten a little crazy these days out there in the field, and we're taking care of sicker and sicker people, and it takes a great deal of. I've been real proud in the courses that our members have taken over the last few years. I think I heard over 56,000 courses last year were taken by our members, so that's outstanding. Nowhere else are CNAs being that motivated to invest in themselves and to be the best that they can be. So I'm proud of the board, and I'm proud of all of our members, and I'm, as always, honored to serve for as long as I possibly can this organization that I love so much. I love and support each and all of our members, and all I ask is that you do your very best so that support is well earned. And we're here to give it to you, I do believe. So I'm going to close this out now, and I thank you all. We've had a great 2 days together, and I look forward to seeing those of you who can come to CNA Fest. But join us on CNA TV anytime, especially for the break room on Mondays. It's a live Facebook from CNA TV where you can ask us questions and things like that in real time. So tune in to CNA TV, like it, share it, and let's make the CNA profession go viral, as well as all caregivers on the front line in every level of long-term care. And I didn't prep the board for this, but every time we close a program, we say, knock out!